Good afternoon, everyone. Welcome to CEDER's Learning Exchange. We will give our audience one more moment to log in and then get started. Good afternoon again. I think we're going to go ahead and get started, although I realize people will be filtering in. Welcome to CEDER's Learning Exchange series. My name is Nadia Islam, and I am one of the principal investigators for National CEDER, or the Center for Engagement in Diabetes-Related Research. With funding by the National Institute of Health, NIDDK, the vision of CEDER is to foster community-led and community-informed type 2 diabetes research, really by integrating partner engagement and partner engagement perspectives across the research spectrum. So at CEDER, we provide a range of services to both researchers and community partners to foster more effective partnerships and to really drive impact in type 2 diabetes related research. So today's Learning Exchange is part of a two-part series where we will explore how to communicate and visualize data. I hope that you'll all agree that it's more important than ever to ensure that communities, the general public, policymakers, decision makers really understand the impact of scientific research and the potential to improve the health of communities. So to that end, I'm very pleased to introduce Mr. Fred LaPolla, who is Associate Curator at the Medical Library at NYU Grossman School of Medicine, where he leads NYU Health Sciences Library's Data Services and Research Impact Team. Fred will talk to us today about data visualization, communicating with communities. So Fred, I'm going to turn it over to you.
All right, thank you so much, and good afternoon, everyone. Hopefully you're having a pleasant day as I just sort of advance forward. So yeah, so just in general today, be speaking for the next little while, but by all means, although there's a formally written in Q&A, please don't feel like it needs to be super formal this afternoon. By all means, feel free to post questions either to the chat. There's also the webinar Q&A that we are monitoring. So again, by all means, feel free to ask any questions you might all have. And of course, while this is for the CEDER program, this, a lot of these principles are not necessarily inherent or specific by any means to diabetes research, and in general, hopefully can be useful, obviously within the context of diabetes, but also more broadly as well. So today we'll be talking about data visualization. Hopefully by the end of today's session, you'll have a sense of ways to tailor your communications to different stakeholders, different audiences. You'll be able to identify some of the best practice in data visualization, and also taking note some of the ethical challenges relating to data visualization. So in general, it's always going to be great to first really focus in on what it is you're fundamentally trying to communicate. And I think that a key component of this is really thinking about what your overall communication goals are, what the information gap that needs to be filled, why, and what's going to fill this. I think that often we can get caught up, especially when we have a lot of information, a lot of good information, in perhaps I don't know if I quite want to say trap, but the way of thinking that, oh, the information will speak for itself. If I present as much information as possible, that will be clear to my end user and reader, the person with whom I'm trying to communicate. So really thinking about kind of what your overall goal is can really help go a long way towards driving your effective communication. So yeah, basically, what is the ultimate result? And what is the ultimate action that's resulting? In some cases, this may be, a true action. You're trying to perhaps change behavior. You're trying to sway policymakers one way or the other in terms of things like funding or supporting specific policies. In other cases, it may be, more informational, really vary based on what is the ultimate goal that you're, oriented towards. It's also important as well to just consider, I'm sure this is very familiar to everyone in this room, but just what is the level of health and information literacy that your audience is bringing to the table. And I think it's also worth noting, when you're considering, um, individuals like policymakers, like public servants, like officials, what is the level of time and what are the kind of constraints that are realistic for that audience? I personally, I'm situated in the library, so I have sort of the bias background that, the people I work with are in a very academic setting, and the kind of time and level of depth that somebody in an academic setting can dig into or allot to a given topic will look very different than somebody in a, say, public policy or, depending on what different context we're talking about. So yeah, so what is that background culturally, professionally, and socially? So it can, of course, mean background, in the sort of what I would maybe think of as like traditional way of thinking culturally, but definitely also considering that different professions, different uh, groups will have different kind of assumptions about what is going to work informationally. And I think in general, it's probably best not to assume that there's going to be like a one size fits all best practice, but really thinking, contextually whenever you're communicating and really letting that goal drive your visualization. So the first topic I'm going to kind of dive into is going to be tailoring to your audience as much as possible. So, of course, it's going to be really important when speaking with members of the community to consider what is the health and information literacy of the audience and really trying to engage members of that target community. Ideally, this will mean, practicing, partnering with members of the community to create visuals that work effectively, as well as to kind of tailor your communications to what is going to be actionable and useful for members of that community. So what we wouldn't necessarily want is just a very information dense communication that might, scare people about their behaviors, but not necessarily provide them with useful, healthy alternatives or useful actionable steps. But we would want to provide things that were more actionable and useful. And to that end, understanding the background and what people can do with this information is going to be essential. So in general, I think to that end, it can be very helpful to consider the life experiences of the individuals you're communicating with. These images come from a paper that was originally, I think, the first paper that they've produced several papers, but the first paper I think came out a few years ago from a group led by an author named Arcia. And they were working uptown with a group called Weiser, which at least the first three letters stood for Washington Heights and Inwood. So, uptown Manhattan, really looking to tailor their kind of general health information to members of the community that they're trying to present to. And they tried out various different types of communication. They tried things such as, standard bar charts, standard plots that you might see in a paper. They tried more, uh, perhaps more engaging images. They found that things that really leapt out at people were things that could relate to kind of uh, th relate to themes that were familiar within those individuals' lives. So everybody in this sample was very familiar, of course, with a traffic light and could sort of intuit what it might mean if, images were shown in the red versus the yellow versus the green. Everyone in this group also similarly could intuitively understand this sort of battery type image. And so it really got across to people. In the same sample, they found that people did really understand, of course, maybe I shouldn't say of course, but people did, similarly understand, a more traditional bar chart type view, which essentially that's all this sleep and energy chart is, but they found it to be less engaging for the end users. Conversely, in certain cases, some images people found to be overly literal. So I know there were some that were images of an individual, sort of an icon of an individual running. And so it was intended to kind of communicate exercise, but people really, a lot of people in the study thought they were just talking about running in particular. So it can kind of also cut against you if things could be interpreted too, specifically. This is just an image illustrating that, in certain cases, the quote unquote more engaging type image was found to be maybe introducing more confusion. It's also worth noting, the end result that they wound up going with did not require like, heavy graphic design skills. I understand that sort of these, higher resolution looking images may be, out of the scope of a normal project, but kind of a more kind of generic type of image wound up also working fine while still leveraging that kind of red, yellow, green mindset or, basis, as well as providing clear images how these issues might appear for the end user. Similarly, when thinking about speaking with people in a clinical setting, different types of visualizations, different types of presentation are going to come across differently and be more or less useful for different contexts. So a study done up in Canada, they found that a majority of physicians preferred kind of a structured text-based critical appraisal of information. In the same study, nurses in the study preferred more of an infographic style of presentation of similar information. Uh, and it's not to say one was more or less useful. We can sort of, imagine that the nurses rounding needed to very quickly be able to absorb information, not sort of sitting down with the structured text. The physicians might be more used to the structured texts. And so in this context, found what they were more familiar with was going to be more useful to them to kind of pull out the most relevant information. In both cases, the individuals, very time crunched, not looking to sort of relearn how to, take in the information. So going with more standardized ways that they could appreciate and quickly get out the information that they needed to get on with their workflows. Similarly, a lot of when thinking about individuals like policymakers, a lot of the advice in the literature tends towards what might be considered best practices in many contexts, but certainly best practices around presenting information simply, quickly, and directly to the end readers of this information. So some of the common steps, one individual who's written quite a bit on this topic named Jonathan Schwabish, who has a blog called policyviz. I believe it's .com, but if you just Google policyviz, it will come up, and has also written various books. I was going to say textbooks. I'm not sure if they quite qualify as textbooks, but guides on data visualization, in particular, a few more kind of tool-oriented guides on the topic. And this individual, really recommends kind of focusing in on presenting simple information to the end reader. He comes from a economics background, so a lot of that's kind of focused on kind of the economic side. And some of the things suggested would be around avoiding clutter, integrating text into a graph. So by that, what I mean is sort of cutting down on the reliance on things like an external key or an external annotation. And often for the end reader, if, for example, text is presented on the chart, it allows the end user to quickly say, okay, for example, what percentage is this, is in this case, Social Security income? Or I guess they're both referring to the same general pieces of information to kind of get the information out of a chart. The less that you're requiring your end user to have to go elsewhere to read and to find information necessary to understand your chart, the better off it's going to be. And he states, show data in a way that makes the message obvious, which is, of course, one of these guidelines that's maybe a little bit easier said than done. But I think thinking back to that principle of, thinking about your goal, your outcome, in education circles, you might be thinking of it in kind of the backwards design, outcome-oriented learning. In visualization, same general idea. You're really trying to think, what are the fundamental outcomes that I want my end reader to be kind of walking away with, especially in the case of individuals who are very time crunched, who have competing priorities, who, you're not expecting are going to be, sitting down with a long read or have the time for a lengthy dive into your material. And over here on the right-hand side, they have these two, this is from the same source, two different approaches to showing similar pieces of information. In a lot of data visualization guidelines, information, the pie chart kind of gets beat up upon. And the pie chart, for those who might not be aware, that's the kind of when we've got the circle cut into different wedges, typically representing proportions of a whole. We'll talk about kind of why that might be the case in a few moments, but they suggest, alternative options, maybe something like a stacked bar chart, which is also being done in percentages, adding up, I should make sure it's truly adding up to 100%, but my eyeballing it does, in fact, say it is. Or alternately, they provide this slope chart. And in general, we're getting two different pieces of information out of this. Here, we're kind of getting a quick high level view of what are the proportions in both time points. So Social Security versus in each year comparatively. And we can kind of see how they stack up, as it were, to proportions of the whole. Alternately, here we can see down here, we can kind of see what is the general shift over time between these different dates. And so it's not to say that one is more or less correct. It's more so to say, to kind of highlight the either the end goal. Do we want to see what is the proportion of the whole in each year? Do we want to see what does the change appear to look like over time? Well, not quite getting the same insight into the proportion of the whole. So depending on what you want the end goal, what your end goal, what you want the end reader to do, may help drive what that data visualization decision kind of looks like. So it's certainly not always feasible, but of course, we would definitely want to be as collaborative and bringing in members of the target community for feedback whenever possible. And really thinking about design as kind of an iterative process, something that we can continuously improve over time. Um, Often, I mean, even to that point of bringing in stakeholders, often it can just be helpful as well, just to, even if you're unable to bring in, stakeholders from the field, it can be very helpful just to have a colleague who's maybe less familiar with your immediate work also take a look. I know I've certainly had the experience, others I've worked with have had the experience of creating some sort of chart or figure that feels like it's really, delivering information. It feels really clever. It can often be challenging to think what's going to be the, most appropriate way to visualize and working to provide something. And then when we bring in somebody who's maybe a little less steeped in the data we're providing, steeped in the topic, we realize, oh, it's too complex or it's too confusing. I need to either simplify it or change it in some way to optimize it for somebody who's maybe not, reading it and looking at it day in, day out, as can often be the case, especially when we are considering when we've conducted research on a given topic to kind of present to others. And there's definitely, realizing I've written 4, but of course there are 5. My apologies, on the screen. But in any event, there's 5 elements identified by Brown relating to design thinking, being empathy. So really focusing on trying to communicate like with your end audience as opposed to communicating at, and thinking as much as possible about systems level thinking. So thinking broadly, what are all of the elements that are going to go into somebody understanding or misunderstanding your visualizations can really help to tailor your visuals for those individuals. It's always going to be important that we're optimistic that change is possible and that the visuals we're creating are going to be useful to that end user. And the last 2, it's going to be very important to be experimental, trying different things, seeing what works, getting feedback and being open to that feedback, and collaborative. So also being open to that communication with our end users, with those who are going to be taking in information. So I want to pause and just see, are there any questions so far? I know I feel like I've been speaking very quickly, but of course, a large topic always lends itself to speaking very quickly. Okay, so in the next portion, I'll dive into a bit of best practices. And it's important to note, a lot of these best practices you'll find in data visualization literature, but I think it's still very kind of more important than thinking of like what are best practices that somebody has written about to consider what's going to work best in your exact context and for your specific audience. So hopefully these can serve as guidelines, but I definitely wouldn't want anybody to walk away thinking that they're hard and fast, rules or laws. So often, and I have some more slides going forward, this question about information on a spectrum, how we're kind of dealing with uncertainty and variability. So we're kind of getting different pieces of information depending on how we divide up our information. So in the case, if we were, for example, jumping back to divide our levels here, and maybe here I have cholesterol, but it could just as easily be blood sugar or A1C, providing information for our end user. We can divide things into separate bins, and in certain contexts that's going to be very helpful, especially in cases where there's strong theoretical reasons to kind of have those divisions. In other cases it may be more useful to think of things a little bit more on a spectrum. Of course it can be very jarring for our end reader, especially if they're getting health information, to suddenly find themselves in the red zone. In other cases, it might be more useful to kind of have this continuous piece of information. But that said, it may become then more challenging to derive strong insights if it's left in this kind of more nuanced context. There's also the challenge of denominator neglect. This was actually data driven, derived from probably at this point out of date information on smoking levels. And I didn't choose Fulton County to pick on it, but mostly just to have a strong difference. This idea of numeracy and denominator neglect. Often when showing proportions, many individuals will misinterpret proportions, or at least according to literature on this topic, due to focusing only on kind of the top numbers on a proportion and not looking into things as a whole. So often it may be helpful to kind of really break things down into images. For example, showing grids highlighting the different levels of of the different proportion to make it more or less clear to our end user. And not assuming that every person who's going to be reading it is going to have the same familiarity with things like proportions, or for that matter, be giving your text enough time to really read and to make sure that they have fully understood the proportions. So again, going back to that example of policymakers, at least again in the literature, there's much on how time limited various individuals can be. And so really focusing in to leveraging kind of the benefit of data visualization, and that you can quickly intuitively understand images often in a way that reading through text may require more time. So when you're considering that, just showing it takes no real thought to understand that this side has more in the red than this over here on the right, in a way that maybe reading through different proportions may require a bit more thought. You don't quite leverage that pre-attentive processing, that kind of instantaneous neuron firing that lets you know this is more than this. Often we may as well be working with qualitative data. And so there's definitely different ways you might be showing how you're presenting your qualitative data. But one key option that can be really beneficial is thinking about kind of creating visuals, creating charts or figures that represent the themes within your text, be that be it interviews, be it focus group interviews. So as you're going through and coding in your themes across the text that you're analyzing, can be really helpful to say, okay, we've identified these key themes. Let's for example, put these in large bubbles of text, and then perhaps even have pull quotes to really underscore those key ideas within our presentation. So somebody who's reading it, who maybe doesn't have time to really dive in as deeply as might be ideal into the body of free text, can also benefit from being able to quickly identify the themes and then say, okay, what quotes I exemplify that theme, and get those insights out. Similarly, large text and shading can also be really helpful to call attention key details. So thinking about, what is bolded, where is the eye going to be quickly and instantaneously drawn to help underscore those main themes that you're trying to present to your end reader. There's also the challenge of something called visual math. So I mentioned earlier when we were looking at that slide with the stacked bar chart and the slope charts, that pie charts, these are pie charts specifically, tend to get a bad rap. And I guess just focusing on any one of these, which would you say is the largest wedge, say, on circle B? And you can enter your answer in the webinar chat. And let's see, red, 5, which is black. And I suspect, and 1, which is also red, I suspect if you're like many individuals, it seems like we're kind of divided between the red and black wedges. Like many individuals, it can be a little bit challenging to kind of quickly get a sense of the data. So conversely, when we look at things kind of in these linear shapes, we can very quickly see, in this case, although on my screen, it's not the easiest to read now that I've said otherwise, but it definitely seems like yellow is appearing higher, over here red, over here black, which at least to my eye, the curved view can be a lot more challenging to view. That's because for most, or for many people, it can be very challenging to kind of quickly with your eye estimate kind of the relative essentially arc length and area of a circle. Conversely, it's very easy to quickly identify how one dimension, the one dimension of length compares to one another. So it can often be easier to try to cut down on kind of the visual math that has to be done, which is this idea of organizing out, what is the largest wedge versus quickly saying what is the longest item. That said, there's definitely cases, especially if we've got 2 to 3 comparisons and the main idea is to show what is the proportion of the whole. There's definitely times where a pie chart can definitely be a fast option, though I personally tend to prefer that stacked bar chart, which is that example where the bars stack on top of each other to equal 100% to show the proportions, but that way you're just comparing essentially how long is each portion. Oh, actually, that's a great question. I see there's a question from Alan on color blindness, and hopefully I do have the slide in a second discussing that exact challenge. There are great resources online. Let's see, do I have it? Yes. So just saying, be careful with color. I'll go back to the one I had in a moment. But there are resources. One site I like is colorbrewer2.org. They're explicitly designed around maps, but one of the nice features is you can actually just filter to use colorblind safe palettes. You can also filter to use either diverging or continuous, continuous sets of hues. So sequential meaning from essentially very pale green to dark green. Diverging would mean something like blue to red, for example. That can be very helpful. Then the other thing I find really helpful, I'll just actually go to the site rather than show you a screen grab. Color Brewer 2. The other thing that's nice is, let's say I'm working in PowerPoint or I'm working in, whatever environment. You can actually get the specific codes for the colors. So then you could choose the exact colors. So depending on your context, maybe you're, something that's going in, it's going to likely be photocopied on a black and white photocopier. You might say, okay, at least if I choose these 3, that looks identifiably different enough. And I can choose those in my, Word document or PowerPoint. So different options there. But yeah, it's definitely a great point. Something like, or at least, I guess I'll say answer live. 10% of the population. I'm not sure if it's 10% overall or if it's 10% of the, biologically male population. Heard it skews more male for whatever reason, is colorblind. I haven't checked that statistic in a long time, so maybe that's out of date. But it is important to kind of, think about plenty of people are colorblind, do colorblind safe. So this is, one tool. I'm sure there's very many tools out there. There's also accessibility checkers available online. I don't recall the names of any off the top of my head, but I have colleagues actually who work, so I'm coming from the library context, who work in terms of keeping the library website up to date and uh, accessible within the compliance. And so being able to run individual pages, individual images across these types of tools can be very helpful. It's also really helpful as well, when thinking about accessibility, whenever possible, to encode an alt text as well. So I know I'm talking about data visualization, but thinking about alt text, something you can definitely apply if it's, in a web context, just as one of the defaults for adding any sort of visual, but it's also definitely possible within PowerPoint. I've heard anecdotally, I haven't explored this, but my colleagues have said, in certain contexts, never to use Google Slides because they're much less amenable to screen readers. Again, I'm sort of taking their word for it, but it's something to think about as well. How are screen readers going to handle it? And whenever possible, can you apply an alt text, alternative text? Often it's something that's encoded like right when you add in the image. So then a screen reader can sort of say, okay, bar chart of diabetes rates in New York City, and so over time, so on. So if somebody is unable to read the visual, it can also be clear. It's also good to really think about how do design elements impact comprehension. Often the kind of example, and the example I've given here is this issue around 3D elements. Many tools, for example, if we're in Excel, it's very easy to make 3D charts, but often that sort of three-dimensional element is not actually meaningful to what we're presenting out. And so it can be sort of hindering to our end reader to have to sort of parse that this isn't really meaningful, and that because it's in 3D, we're sort of losing our ability to really quickly comprehend what we're seeing. I mentioned this in passing before, but it can be really helpful as well to think about pre-attentive attributes and focal points. And this, again, is this idea that there are certain elements that many individuals can just identify without having to kind of consider and think about. So if you think in contrast to a text-based approach where you have to really read through something and say, okay, what does this say? What doesn't this say? Uh, we can, or we can very readily identify, okay, one of these shapes is not like the other, one of these shapes is different color, without having to kind of read through it. We saw that in the case as well with the bar charts compared to the pie charts, where the length was immediately apparent different from the curved shapes, from the arcs of those circles. Similarly, I mean, the probably the chart that gets hated on the most in a lot of the data viz literature is going to be the donut chart. That's what, like a pie chart where somebody has cut out the middle for whatever reason. Sometimes it can look kind of nice, like it looks sort of futuristic, but it can be really hard to meaningfully make comparisons, again, because you're really asking your reader to kind of estimate in these circular shapes that the eye doesn't quite as readily get a sense of. So some of the other things, so I mean, really length, width, and size all kind of factor in together, but also different shapes. If there's movement, which way the movements are going, if they're enclosed, if the colors are more or less intense. So all things that we can kind of quickly identify to help our end reader get a sense of what we're presenting without having to kind of spell it out in text. Can also be useful. This is kind of drawing on that same point, this idea of hue and intensity. Often it can be useful if we're trying to present key pieces of information to really delve in to our data. So this is a chart. I think this was from a data viz researcher named Alberto Cairo, but it's suddenly occurring to me that many of these individuals' names in my head are swirling together, but they are in the works cited page if you're looking to do a little bit more reading, kind of looking at every nation in this case sort of colored in, whereas over here they decided specific nations that they were looking to highlight, putting those in bold colors while graying out additional information. Again, the idea here is we can kind of quickly identify the pieces of information we want to identify and communicate to our end reader without overwhelming them by having everything be kind of intense to look at. One data viz expert, a writer named Cole Nussbaum-Knaflic. It's very possible I've switched their names, but I'm pretty sure Knaflic is their last name. Um, they have a resource or a book called Storytelling with Data, really oriented towards business readers, but I think a lot of the context is useful as well, and kind of like a communicating with the general public as well as communicating with policymakers type context, where their recommendation is actually, let's say you're creating a visual in Excel, it's just to, at the outset, turn everything pale gray. And then say, okay, what are the things that I want my end reader to really focus in on? What's the first thing I want my end reader to focus on? And then choosing those elements and making them, darker and bolder and more eye-catching accordingly. So that way you're not kind of just at um, the mercy of the arbitrary or seemingly arbitrary design elements that kind of come built into Excel, which will generally, give a lot of preference to the title and maybe a little bit, less, to other pieces of information. So if you say, oh, what I really want people to focus in on is the actual, chart figures, then maybe make those the boldest. I'll also just note, because I have my eye on the chat as well, would not be doing my due diligence as a librarian if I didn't recommend also seeing if we have it. We've got a lot of resources available for people at NYU. So by all means, always worth checking to see if we have these resources. I believe that is available as an ebook here. Could be mistaken. But in any event, I found it to be a very readable, very quick, because it is really written for kind of a business audience. So there's not a lot of text wasted, if that makes sense. So it's important to also think about ethical communication. One common issue is going to be this issue around uncertainty and error. Of course, the Slido is not working, so I'm just going to skip past any sort of real interaction type questions. And just to think about, when we think about error and uncertainty, and for that matter, bias, in the context of what we're thinking about here at its most core level, the error is going to be the difference between our observed values and our true values. So we might be referring to things just that, in any given sample we have, there's going to be some difference between the results. If we take the A1C of our sample, there's going to be some difference between the sample's A1C levels and the full population in the world. And it's not to say we did anything wrong necessarily, but it is to understand that there's always going to be some degree of uncertainty that we're presenting or that we're encountering whenever we're trying to measure something or present something. And again, in the context here where we're thinking about data visualization, often we may be accustomed to thinking of bias in kind of what I would think of as like plain language usage, like interpersonal bias, bias against certain groups, that sort of bias. But it is important to, bear in mind, bias can really just mean as well the kind of broader usage of a systematic introduction of error. So if we've made a huge, or if we've been unrigorous in how we've sampled our population, that error that's setting it apart from the true population suddenly becomes much more systematic and much more of a bias in our outcomes. It becomes much less reliable for our end readers to draw conclusions from. And so there's always going to be this variability. If we randomly sample 100 people over and over in Brooklyn, for example, where I currently am, and we took A1C levels, we would expect those A1C levels, that mean, to be different, but similar across our end results. We may also have issues around imprecise measures. So if we were surveying people on, their attitudes about their diabetes care, there's a certain extent to which hopefully our survey measurements are correctly and accurately and reliably and validly measuring that, those attitudes, but there may be imprecision, there may be inaccuracies. And so those will all kind of introduce these measurements of error. And so it can be really important to think about how we're going to present error, since there is going to necessarily be this uncertainty that we're presenting. Common techniques for presenting error include error bars, where we're sort of saying that we believe that the true value in 95 out of 100 cases falling within these error bars, as well as doing things like presenting individual data points. And in tests with readers, consumers of data, often these different types of visuals have presented sort of different sorts of challenges. I think it's actually maybe on the next slide. Uh, yeah, so a lot of this really came down to, this is from this paper by Holman, where they were working with people, a lot of their comfort and background experience. Many people in this study, they felt that a given kind of the true average was more likely to fall somewhere within this green or this blue area rather than in this white area within the error bar. So in a way, it wound up being kind of misleading to the end reader. Uh, Whereas things where it was a little bit more grayed out, it did sort of highlight the uncertainty within the data. And in other cases, I've definitely heard that some people really like these violin plots, but they can require a higher level of comfort with charts and a higher level of experience with charts and viewing them. So they, might be appropriate with somebody who's, for example, like a research scientist, but maybe not with the general public or with policymakers for whom they might see this sort of visual and shut down. So it's important just to think about, how am I presenting the uncertainty inherent in my visuals to others so that I'm not misleading them in some way? And yeah, this is just presenting. I guess it was actually Brundage who noted that in a study of patient outcomes, the error bars often created challenges. Oh, this is actually a slightly different point. They do create problems. Many people prefer a simpler chart, but it is important just to be aware, at the end of the day, you're kind of making these rhetorical decisions. So it may be, on the one hand, preferable to present, a simpler chart to make your point. But it is important to kind of keep in mind that there is a bit of inherent, you may be losing some of the nuance and the truth of the inherent ambiguity when you present things as a very simple chart. And to that point, so this was from actually a review in the, this was from a blog from the The Economist, where they were comparing their own charts, saying they'd done certain things that they preferred and certain things they didn't. And they, in general, preferred their options on the right-hand side, where they were sort of trying to simplify down information. That said, you get much less of a sense of kind of where these other nations might fall over in this section. You get much less of a sense of how these values might change at specific time points if you sort of just smooth things out. So it's important to keep in mind that simplification can be helpful in terms of making things readily understood, but it is also important that there's a counterpoint, that there is some complexity and nuance, and depending on what the the audience is and what level of information the audience needs that information or might desire that information, just focusing on simplicity can also kind of maybe not be the most ethically transparent choice, depending on what your end goal and what your kind of framework for viewing that choice is. Leave that behind. And so it's really just to kind of underscore that our visual choices, they're not hard and fast laws. We're really trying to persuade our end readers of what it is we're communicating. We want to really, leverage the expertise we have, but it's not to say that these choices are made kind of in a neutral vacuum, that clear and simpler is necessarily more honest towards the underlying data. So it's really important to think, when there is that uncertainty, when there is that ambiguity, how are you communicating that to your end user? There may be, there may of course be cases where you need to just present the, mile high view to individuals, but there are certainly other cases where the individual is best served by being presented with the most transparent, and I'm like avoiding using the word honest, but to me it feels like the only word that's available, that the most transparent and most clear when there are these realms of ambiguity. So yeah, we saw with the economist visualizations, making any sort of chart is going to entail making a high level of decisions around what it is we're fundamentally presenting, where we're presenting, what's going to be complex, what's going to be simple. And it's not to say that one choice over the other is going to be misleading, but that we do want to really try to communicate in a way that's trying to be reliable and true and convince our readers that our message is reliable and true. So to that end, really focusing in, on what is going to be useful, what is going to make sense to that end user is going to be really helpful to those end users. And I mention this because in some of the kind of historical context, a lot of thought leaders, a lot of data viz gurus, individuals like Edward Tufte, I just mentioned Cole Nussbaum, Knaflic, and Alberto Cairo, they really focus a lot on this idea of simplicity. They will frame things this idea of clarity. And it's not to say you don't want to be simple and clear, but I think you do really want to think about, what is the broader scope when sometimes the ambiguities of the data you're presenting are important to the end readers of that data. So for example, I know Edward Tufte goes kind of, in my opinion, a little bit extreme, favoring a visualization such as this over to the right. I apologize that this is maybe a little bit grainier. A lot of his books, at least last I saw, were not readily available online over this because this is using less ink or less pixels to view, really using this idea of visual load, that kind of the less you have to read, the more quickly you understand it. And certainly to a point that is true, like you don't want very heavy, hard to read, very cluttered visuals for your presentation. That said, I think that it gets a lot of these individuals can kind of get a little bit dogmatic at times. It's really not something that I would recommend. I think being a little bit more experimental and focused on your end user rather than relying on what this expert versus that expert says is going to be a better option to kind of present things a little bit clearer and a little bit more, truthfully to your end audience. Just keeping an eye on the time. Yeah, a lot of this does also kind of draw from this idea of Gestalt psychology of seeing kind of the whole before you see the parts and really focusing in on what's going to be like the cleanest option. But conversely, there is definitely research that sort of points in the opposite direction. So this was from an individual or a team led by Bateman. They were trying to, bring this out of the realm of kind of the thought leaders, the, data viz gurus, and a little bit more experimental. They studied with individuals essentially on recall of data visualizations. And they found, so this was pulled from a newspaper, this sort of monster view. Admittedly, it's like overtly intended to be a bit more sensational versus the simplified, more Edward Tufte style. But they did find that in this case, in this group, a more designed chart did improve recall. So all just to say there's definitely contexts where you're going to want to really focus on engagement over maybe just simplicity. And there's certainly contexts where you're going to want to focus in on detail and ambiguity over clarity and simplicity, depending on what your end user is and what that audience is. Again, really focusing in when we think ethically, what is going to be the truthful information for that user that you want to provide them. When you bear in mind that at the end of the day, when we visualize in this context, we are trying to convince somebody of some point. It's also worth noting that often visualizations that are very clean and easy to read, they may hide important important ambiguities. So things like chloropleth maps, so a very common type of visualization where we might have a chart where different regions, different locations are shaded. We might be getting the sense like of a degree of uniformity where perhaps it's not really the case. So we can also think of the sort of political maps that color everything in red and blue that belie a lot of the ambiguity inherent in things. So within the last 10 minutes or so, this is just the source of this. I was wondering, based on the things we've discussed, what your thoughts and critiques might be for comparing these different visualizations. These are showing different sorts of items pulled from AHRQ, but what works well, what doesn't work well, and what might you try doing to kind of present things differently. I also received a slate of visuals that we could also look from Emma's team. So also happy to jump over there, and also happy to take questions because I realize I've gone slightly longer than the originally planned time. But in your opinion, what makes sense or what doesn't necessarily make sense, say, about the left or the right chart? And feel free to add to the chat. Or maybe saying what makes sense and what doesn't make sense maybe is not helpful. Maybe it might be more useful to say, what might you improve if you were trying to present, information to end readers? I realize, yeah, I'm kind of going against what my own statement was, since I was saying so much of this is going to be contextually dependent. So there is sort of that limitation as well. Yeah, answering different questions. So kind of dialing in on the left, we see more around obesity levels and giving the percentage. On the right, giving more around different medication levels. Maybe the one on the right is a little bit more interesting as I sort of uh, more dive in. So yeah, the labels at the top mean you're sending your reader elsewhere. So it might be more helpful if they had found some way to represent insulin and diet and, or I guess diet and medication, diet only, or none. And I'll note I've also definitely seen, things on specifically on that policy viz site where they note, part of the challenge with this sort of chart is it can, fortunately here they have the numbers listed, but sometimes it can be a little bit challenging. If we wanted to know, for example, how does diet and medication compare across groups, it could be a little bit hard since they all have slightly different baselines. Both are very wordy. So yeah, finding ways to kind of cut down on all of the text can also be helpful as well, so that the end reader can kind of at a glance determine what it is they're supposed to be being determined. Because yeah, truthfully, I mean, I'm not really sure what the end goal of either is necessarily supposed to be, and I think that's probably a point against either chart. We would hope, that we could quickly, readily identify what is going to be, useful for our end reader. Um, let's see, the right may make sure if they sorted percentage by largest, smallest, if they wanted to compare medication use across demographic groups. Sure. And I'm going to skip any review questions since Slido was malfunctioning, but I want to hand things back to Emma to kind of have the closing and next steps. I'm happy to also advance the slides. But before I do hand things back, I do really want to thank you all so much for taking the time this afternoon. It's been a pleasure to digitally meet with you all, and I hope you have a great, rest of these sessions and, great rest of your day.
Thanks so much, Fred. Really appreciate it. And thank you all for joining us today. Again, this is part one of a two-part Learning Exchange webinar series we have on data visualizations and diabetes. And just to very quickly wrap up, just wanted to mention again, CEDER provides free consultations and studios to community groups and researchers and a variety of partners on type 2 diabetes related research and programs. This slide just outlines how we can work with all of you. We'll also put in the chat just a link about more information about our services and how to request them. But again, just want to emphasize they're free. We have an amazing group of experts across the country who are here to provide support on your projects and are really excited to work with you. Next slide. So again, our next part in the series is on September 30th with Ben Spohr from the Health Dashboards Initiative here at NYU Langone Health. We are so excited. If you haven't checked out the City Health Dashboard's website yet, please take a look, get a preview on what Ben will discuss, but we're super excited for him to join us in a couple weeks, and make sure to register. And then lastly, please complete our evaluation for today. We really want your feedback on how things went and how to improve in the future. So please, it should only take a couple minutes to do. We'd really, really appreciate your help. So with that, the last slide is just, again, a reminder to visit our website. There's a ton of information about who CEDER is, what we provide, our wonderful experts. And again, we're planning on doing a number of these learning exchange webinar trainings and presentations over the next year. So hope you join us in the future. Thank you so much. And again, we'll share the slides as well as the links. And I'll just say Fred has at least a 5-slide bibliography with all of the amazing resources that he shared today. So we will share that as well. But just a ton of great resources. Thank you, everyone. Enjoy the rest of your day.